So my name is Dr. Rebecca Moore and I'm a consultant psychiatrist, and my expertise is really in all of general psychiatry, but particularly around trauma and PTSD. And I think that's why I was drawn into cannabis prescribing, medicinal cannabis prescribing as well, because I've seen a lot of research around its use with trauma and seen the effects as a prescriber. I'm also particularly interested in women's mental health, and I do a lot of work around trauma through pregnancy and in early motherhood. So that's me in a nutshell, really. I should also mention that I'm one of the co-founders of an organisation called Make Birth Better, because that's something that I'm really passionate about, and it's a campaigning group around making pregnancy better for women. So I see a wide range of patients coming to see me in clinic, and they often have a very long history of contact with mental health services or with their GP, and might be presenting with anxiety, low mood, trauma, lots of different presentations. And I think what's often a common theme is that people are coming that have tried lots and lots of things in the past and never really felt that that's been particularly helpful for them. So they might have tried numerous prescribed medications, different types of therapy, exercise, but never really found the right thing that they felt controlled all their symptoms for them, and particularly about quality of life. So I've been aware of medical cannabis for quite a few years now. At university, actually, I had a friend who had a cancer diagnosis, and I watched her use cannabis and saw how helpful that she found it for her symptoms. And then during my training, and more recently, I've been lucky enough to be able to go and shadow some colleagues in America and see them prescribing medicinal cannabis, and was just really astounded at the efficacy of that for people. You know, people coming back and reporting that it had helped them with so many different aspects of their life: pain, sleep, mood. So I was really interested and intrigued by that, and very much wanted to be part of this when it was possible in the UK. And I think another thing for me is I'm really, really keen that people know all the choices and options that might be helpful for them in terms of healing and treatment. So I've always been somebody who's talked to people about their diet, supplements, exercise, and the role that these can play in our mental health. And so for me, medicinal cannabis really fits nicely within that framework. It's really important to me that people are aware of all the choices that might help them, and that their treatment is really bespoke for them. So I really feel that medicinal cannabis is something that we should be talking about with people, because for many people it can be a really, really good choice in terms of their treatment. So for prescribing, for me, I think one of the key things was that I felt, first of all, that I was really passionate and had seen how helpful medicinal cannabis could be for many, many people. And secondly, because it's very new in the UK, really, I was really excited to be part of something at the forefront of what I believe is going to be one of the most important fields of medicine over the next decade. So for me, it felt really exciting to be part of that and at the forefront of this new field of medicine. And specifically in terms of prescribing within the project, I think one of the key things as a new medicinal cannabis prescriber is always being asked about data and where's the evidence. So the fact that we have this wonderful project that's capturing data from people presenting lots of different conditions is so, so important to me. Firstly, the people that I'm working with really like themselves feeling that they're part of this project and that they're contributing contributing to something that's going to be really helpful for others. So there's a real sense of people wanting to help. And, you know, for me, I hope that it means that we have this amazing array of data which we can use to transform the way that medicinal cannabis is prescribed. And clearly, you know, the end goal for me is I would really like that to be available for people on the NHS, so that there is equity of access for anybody who wants to consider it as a choice. Because at the moment, a lot of people, you know, can't access that because of the costs. So I very much hope that it means that we have this brilliant data set which shows, look at this amazing medicine that really helps people, that has very few side effects, and we're going to get this onto the NHS formulary. And alongside that, obviously, you know, there'll be data that can be published so that everybody across the world can learn from this.